Breathing, something so essential to life, yet something we often take for granted. Every breath we take goes unnoticed until it becomes difficult. For millions of people around the world, breathing isn't just a routine, it's a struggle. Today, we're diving deep into understanding asthma, a chronic condition that affects over 350 million people worldwide, with more than 25 million people in the United States alone. That includes over 5 million children, and the numbers continue to rise. In this video, we'll explore what asthma is, what causes it, its symptoms, and how it can be managed. Plus, we'll discuss natural remedies, lifestyle changes, and exercises that can help alleviate symptoms. So what exactly is asthma? At its core, asthma is a chronic condition that affects the airways in your lungs. These airways, which carry air in and out of your lungs, become inflamed, narrow, and can produce excessive mucus, which makes it harder to breathe. This narrowing of the airways can lead to wheezing, shortness of breath, and persistent coughing. While asthma is a lifelong condition, it can be controlled effectively with the right treatment and lifestyle changes. It is important to know that asthma doesn't have a cure, but with the right care, people can live a full and active life. If left untreated or mismanaged, asthma can become life-threatening. This is why understanding the condition and its management is crucial. Now let's break down exactly what happens during an asthma attack. There are three main processes that take place, each making breathing harder and harder. First, we have bronchospasm. This is when the muscles surrounding your airways constrict, causing the airways to narrow. This reduces the amount of air flowing in and out of your lungs, making it difficult to take a full breath. Bronchospasm is often triggered by allergens, irritants, or environmental changes. Next comes inflammation. The lining of the airways becomes swollen and irritated. This swelling further restricts the flow of air, making the airways even tighter. Inflammation also makes the airways more sensitive, so they react more strongly to triggers like cold air, dust, or pollen. Finally, there's mucus production. As the body reacts to the inflammation, it starts producing thick mucus which builds up inside the already narrowed airways. This mucus can make it even harder for air to pass through, and it can lead to coughing as the body tries to clear it out. The excess mucus also contributes to wheezing, as air struggles to flow through the constricted airways. When all of these factors combine, bronchospasm, inflammation, and mucus, the result is a significant decrease in airflow, making it incredibly difficult to breathe. During an attack, these changes cause symptoms like wheezing, chest tightness, shortness of breath, and persistent coughing. In severe cases, an asthma attack can be fatal, which is why it's so important to manage the condition and seek help during an emergency. Asthma can look different from person to person, and it's often categorized by the frequency, severity, and specific triggers of the symptoms. Let's take a closer look at the different types of asthma. There's intermittent asthma, where symptoms come and go. People with intermittent asthma may experience flare-ups occasionally, but between these episodes, their breathing is normal. They can typically go about their daily lives without much disruption. Then there's persistent asthma, where symptoms occur more regularly. This type of asthma can interfere with daily activities, and flare-ups are more frequent. People with persistent asthma may experience coughing or wheezing on a daily basis, and it can be more challenging to control. Asthma can also be triggered by specific factors, which makes it even more complex. These triggers include allergic asthma, which is triggered by allergens like pollen, mold, pet dander, or dust mites. In fact, around 60% of asthma cases are related to allergies. Exercise-induced asthma, which occurs when physical activity triggers symptoms. This can happen during exercise, especially in cold or dry air, affecting people during outdoor activities like running or playing sports. Occupational asthma, which is caused by exposure to irritants in the workplace, such as chemicals, dust, or fumes. This is especially common in industries like agriculture, construction, and manufacturing. And then there's asthma COPD overlap syndrome, ACOS, which is a combination of asthma and chronic obstructive pulmonary disease, COPD. This condition is often found in older adults who have both asthma and chronic bronchitis. Now that we understand the types of asthma, Let's take a deeper dive into what causes it. While the exact cause of asthma remains a mystery, researchers have identified several factors that increase the risk. Genetics. If there's a family history of asthma, allergies, or other respiratory conditions, you're at higher risk. Studies show that children with one asthmatic parent are more likely to develop asthma themselves. Environmental factors. Exposure to pollutants like smoke, air pollution, and toxic chemicals, it can trigger or worsen asthma symptoms. Cities with higher levels of pollution have higher asthma rates. In fact, air pollution is one of the leading environmental causes of asthma worldwide. Allergies. People with allergies, especially those triggered by pollen, dust, and pet dander, are more likely to develop asthma. This is often the case for people with allergic rhinitis or hay fever. Respiratory infections. Certain viral infections, particularly during early childhood, can damage the lungs and increase the risk of developing asthma later on. In fact, children who experience frequent respiratory infections may be more susceptible to developing asthma as they grow older. Many factors can trigger an asthma attack, and recognizing them can help you better manage the condition. Common triggers include allergens, pollen, dust mites, pet dander, and mold can all trigger asthma symptoms. Air pollution, smoke, and strong odors. These irritants can inflame the airways and make breathing more difficult, particularly in urban areas. Cold air and sudden weather changes can also be triggers. People living in colder climates often experience worse asthma symptoms during the winter months. And even physical activity or stress can bring on symptoms, making it important for those with asthma to stay aware of their limits during exercise or stressful situations. How do you know if it's asthma? Symptoms can vary from person to person, but they often include wheezing, a whistling or squeaky sound when breathing, especially during exhalation. Persistent coughing, especially at night or early in the morning. This is a common sign that asthma is not well controlled. Shortness of breath, particularly during physical activity or at night. Chest tightness or pain, which can feel like a heavy weight on your chest, making it hard to breathe deeply. To diagnose asthma, doctors will typically use a combination of methods. Spirometry. This test measures how much air you can breathe in and out and how fast you can exhale. It helps doctors determine how well your lungs are functioning. Allergy testing. This can help identify what allergens or irritants may be triggering your asthma symptoms. Peak flow monitoring. This tracks the efficiency of your breathing by measuring how fast you can exhale air from your lungs, helping to identify any early signs of asthma flare-ups. Asthma management involves a combination of medication and lifestyle adjustments. Some of the most common treatments include bronchodilators. These quick relief medications open the airways during an attack, providing immediate relief from wheezing and shortness of breath. Anti-inflammatory drugs, such as inhaled corticosteroids, which reduce airway inflammation and mucus production over time. For severe asthma, biologic therapies are available. These medications are used for patients whose asthma isn't controlled by traditional treatments. But medications are just one part of managing asthma. Lifestyle changes also play a critical role. You can avoid triggers, limit exposure to allergens, smoke, and pollution. Use air purifiers and make sure your living space is free of dust and mold. Have regular checkups with your doctor to monitor your symptoms and adjust treatment as necessary. Along with medications, certain home remedies and lifestyle changes can also help soothe asthma symptoms and provide relief. Ginger, known for its anti-inflammatory properties, ginger can help reduce airway inflammation and ease breathing difficulties. Adding fresh ginger to your tea or meals can help reduce asthma symptoms. Honey has natural soothing properties and can help reduce coughing and irritation in the airways. A teaspoon of honey before bed can help calm symptoms. Steam therapy. Inhaling steam can help clear mucus from your airways and make breathing easier. You can use a steam inhaler or simply sit in a bathroom filled with hot water vapor. Breathing exercises. Certain breathing techniques, such as pursed lip breathing and diaphragmatic breathing, can help strengthen the muscles involved in breathing and improve lung function over time. Physical activity. Light, regular exercise can improve lung function and reduce asthma symptoms. Activities like swimming and walking can be excellent choices, as they help improve cardiovascular health without overexerting the lungs. Some foods can help manage asthma symptoms and improve your lung health. Fatty fish like salmon and mackerel, rich in omega-3 fatty acids, can reduce inflammation and improve lung function. Apples and other fruits high in antioxidants and vitamin C help strengthen the immune system and reduce airway inflammation. Turmeric, with its active ingredient curcumin, can act as a natural anti-inflammatory and may help relieve asthma symptoms. Finally, exercise can also play a key role in managing asthma. While vigorous physical activity can sometimes trigger symptoms, regular, moderate exercise can actually help improve lung capacity and reduce asthma flare-ups over time. Activities such as walking, swimming, and yoga are especially good choices. Remember, always consult your doctor before starting a new exercise routine, especially if you have asthma. Asthma is a chronic condition that requires careful management, but with the right tools, treatments, and lifestyle changes, you can take control of your health and live a fulfilling life. Whether it's through medication, natural remedies, or simple lifestyle adjustments, the key is understanding your triggers and managing your symptoms with care. Stay healthy, breathe easy, and take charge of your well-being.